I probably shouldn't say this, but surgery can be a cruel mistress sometimes. You do the same thing time and time again, and everyone's happy. What could possibly go wrong? Well, hip surgeons like me are usually perfectionists. If you aren't happy, I take it personally, and I want to make things right. Often the problem is just simply due to unrealistic expectations. Trying to run before you can walk. People might tell you they knew someone who had a hip replacement, back to playing tennis and playing golf, skiing, running, all sorts of things. What's wrong with you? Well, nothing usually. In my experience, it takes about 3 months to get to the point where you're not thinking very much about your new hip, and a year to 18 months before your body and brain have truly settled down. It's during this time that people are aware of all sorts of things, aches and pains, feeling out of kilter. You think that something's gone horribly wrong and you're going to have more surgery. Well, that's quite understandable. The problems that I see in the first few months are things like leg swelling, persistent pain, usually in the upper thigh, or a feeling that one leg is longer than the other one. Some people have back pain or they can't stop limping. These symptoms usually gradually get better within a few months, and all that's needed is a bit of reassurance and perhaps a few sessions of physiotherapy. Of course, more serious problems can happen, such as infections, blood clots, dislocation and nerve injury. And that's why it's important to seek advice if you're worried. That's what I'm here for. My job is not just to do the surgery, it's also to help and guide you through your recovery and to make sure that you have the best outcome, whatever happens. If you'd like more information, please get in touch, send me an email, call the office, the details are here. Thanks for watching. I'm Jeremy Latham and I'm the hip surgeon.